Good afternoon, everybody. Thank you so much for joining us again on another segment on our Spotlight on Business series. We always say we have a great business with us every week, and this is certainly no exception and a little bit different, which we like to throw into our mix of businesses. And that is, this is an industry that really isn't tourism related. It's really focused on the residents here in Pagosa Springs, so a service industry. So we are here on Put Hill with Hurst Hearing today. And I think that Jen Hurst, the owner of Hurst Hearing, has a super interesting story to tell us. So let's meet Jen, and here we go. Hey, Jen, how are you today?
Good, thanks.
Well, we're here. We're going to back up just a little bit. We aren't in an audiology room, but we are here in your lovely office. But tell us a little bit about Hurst Hearing. We're excited to be, well, I still think it's a fairly new facility, but you've moved from where you started in Pagosa Springs to a new facility. So how long have you been here on Put Hill, right down the couple doors away from Ponderosa?
We've been in this building for a little over a year. So before that, I was renting a room at Pagosa Medical Group, and before that, I was doing all mobile visits.
Oh,
I was
wow.
doing patients' homes. So
Wow, that's different. How did you just decide to do mobile, and how was that industry?
Well, that was a COVID thing.
Ah.
So when I moved here from Santa Fe. We've been in the area for a long time, and we used to come to Pagosa on vacation quite a lot. And when I was working in Santa Fe, when COVID happened, the clinic that I was working at shut down, and they decided they weren't going to reopen. They had some other things going on, and so I was without a job and without a plan, and we had talked for many years about Pagosa being a good place to start a practice. And so we said, well, let's do it. We might as well. No time like the present. So we moved here, and because it was in the middle of lockdown, we thought that a mobile startup would be the way to go, and a nice kind of easing into starting a practice, which it was. It was great. So I did primarily mobile for the first couple of years.
Wow.
And then started renting the space from Pagosa Medical Group because I was getting a little too busy to do all mobile. Then I got too busy for the little space I was at there, and that's when we moved here.
So in your industry, what is kind of the scope of work that you offer?
The scope of audiology would be hearing and balance evaluation and treatment. I don't do balance work here at this clinic. I have in the past at hospitals and such. So the scope of my practice in particular is hearing and tinnitus evaluations and hearing aid sales and adjustments and repairs and all of the things that go with hearing aids. And primarily adults here is what I do. I have a long history of pediatric audiology and balance work and a bunch of other stuff. So
the whole range of ages.
Yes.
You know, I think in the hearing industry, we don't think of children really. We just think of the aging population, which according to the Colorado State Demographer, Pagosa Springs is certainly an aging community, although we're certainly trying to attract younger families as well. But do you see that trend in your business?
Yes, definitely. So when I've worked at hospitals, I saw a lot of pediatrics. The nature of more of a hearing aid focused practice that I'm doing is definitely more older adults typically. Okay. So Pagosa is a really good place, obviously, to do that. It's been great, but I don't see a lot of pediatrics.
Okay, well, anybody watching the Spotlight, just know that service is available here in Pagosa Springs. You know, on our segments, a lot of the businesses, obviously, Pagosa Springs is a tourism-related economy. However, your industry really is not. You focus on the residents and people here in Pagosa Springs. Do you see any correlation between the ups and downs? You know, summer is extremely busy, weekends in the winter, certainly April, May are a little slower in between. So there are certainly the tourism trends. Do you see any of that in your business?
Yeah, definitely.
Really?
We have a big influx. In fact, the last, I would say 2 or 3 weeks, we've had a bunch of people who are about to leave town for the winter come to buy their hearing aid supplies and have their hearing aids cleaned and checked to make sure that they're good to go for the winter. And then when they come back in the spring, we'll see them again for those same kinds of things. So we do definitely for our part-timers, so not necessarily tourism, but part-time.
Second homeowners, sure. Okay.
So we see a lot of those patients and kind of coordinate with their, you know, if they have an audiologist in Texas or wherever they may be, you know, kind of coordinating their care. So it's definitely a big part.
Sure. Well, the other thing that we talk about when it's a tourism related industry or business is how those fluctuations affect you as a business owner. So you've been in business now for years. We do ask, you know, are there any kind of tips or tricks that you've learned over the years that you said, oh, wow, I never planned for this, or this kind of hit me, or boy, I wish I would have known when I opened. Has anything, okay, we only have 10 minutes.
If we've got several hours, I could make a list. There are a lot of things I wish I had known. All right, so if you're talking about specifically to the Pagosa area,
sure,
unique to the area. Oh gosh, I can't think of anything. I mean, there are a million things that I wish I had known. I would say the biggest thing that I've learned here, it's a small town. Pagosa is a small town, and the smallest town I've ever practiced in. And so I think that getting to know other business owners and making contacts in the community here is probably more important than in a larger town, I think.
Well, and certainly we'll do a plug for, you know, a great way to do that is through the Chamber's networking and the business after hours.
Absolutely. The business after hours has been a really good way to meet people. And it's a little harder to, you know, there it might be a little more difficult to find, for example, an attorney that works with my kind of practice or whatever. So getting to know people in the community and getting those resources has been really
great advice.
Making connections.
Anything else that you can think of that has there been a highlight for you here in your business?
Yeah, so one unexpected thing I think is when I started my practice, I did not realize how many veterans we had in the community.
Okay.
And I started working with the VA. I got a VA contract, and I see a huge number of veterans. And I love it. It's been a really cool part of my practice. I've never worked at a place where we had a VA contract.
That's
and so
awesome.
That was all new for me. And their specific needs and you know, how to make that work. It's been really a cool surprise for me. I would guess that maybe a quarter to a third of my patients are veterans.
Wow, that's amazing.
Really,
and that is getting that contract obviously through the VA or through that system.
Yeah.
Did you have to become, is it just a contract, or did you have to go through PTAC and become a certified government contractor?
No, not a government
not in this industry.
So I'm a community care provider.
Okay.
And so I just have to have and you have to jump through, of course, with the VA, a lot of hoops. There was a lot of hoops to get to that point, but I am just a community care provider, not a government contractor.
Great. Okay. Well, I think that's exciting. Has there been anything you wish you hadn't have done? Maybe as a word of warning for any businesses. You know, we've heard a lot of, especially in the tourism related, you know, when the times are good, don't feel like you're totally flush and run out there and, you know, blow your wad. But that's tourism. Anything that you've found out either in your old facility or moving to a new facility, anything you know, any words of wisdom there?
I can't think of anything right off. It just occurred to me when you were talking about sort of challenges and things unique for this community. I will throw out there that we're hiring a patient care coordinator full time. That's been tricky in this area, and I think that I'm not alone in that, just finding staff and keeping staff in a community where, you know, the pricing is a little higher.
Sure.
So that's a challenge. So when you say, would I do anything differently? I have had some great patient care coordinators. I guess I would just say that I wish that they had stuck around. You know, my second one is living in the area. Sure. So that just creates a challenge. I'm really glad that I bought my own building. That's been a real positive thing.
Great.
There's probably a million things that I would do differently, but I can't think of anything else right off.
So let's jump back to your business just for a minute or two. And I think many of us think, oh, I think I hear fine. Mm-hmm. So I'm okay. And, you know, it's kind of like we don't go to most medical providers until we're really sick. Would you like to talk just a minute about, you know, preventative or the industry as a whole, what we should be aware of and alert to?
Yeah, definitely. So we recommend that adults age 60 and over get a hearing evaluation. And that is, it's good to have that baseline. And then if your hearing is pretty good, we can track it over time and just kind of keep our eye on it. And if there's an issue, we can catch it early. So that's a really important thing. It's really nice to have an evaluation in our system so that if several years down the road you start to feel like you may not be hearing as well, we have a comparison to see what kind of change you've had over time. And also, especially if, for example, a patient who might have a lot of noise exposure in their life through work or firearm use or whatever it may be, to monitor that and make sure that their protection is sufficient, that they're not creating damage over time. Most insurances will pay for a hearing evaluation, including Medicare, and a lot of people don't realize that because
I don't think
Medicare
they do.
Doesn't have hearing health benefits for the most part. They don't have, they don't help with hearing aids, but they will pay for a hearing evaluation.
Okay, I think that's great. That's great information out there because I have it and I didn't know that. Yeah. So there you go. Yeah. And I think there's a number of people like me out there that don't know that information.
Yeah, we share that a lot.
Great. Yeah. Perfect.
So most insurance will cover an initial evaluation.
Perfect. Well, thank you so much for being a part of our series. Is there anything else you'd like to mention before we, as we say, call it a wrap?
One thing that I'm excited about, and actually no one knows this yet.
Boy.
This is like, you heard it here first. So it's been just me and my patient care coordinator, and I've been working 3 days a week. So we've been open Tuesday, Wednesday, and Thursday for quite a long time. And I'm hiring a new audiologist, and we're expanding our hours. So I'm really excited about that. So I think I can announce it. I think we're for sure enough at this point that I can say he's going to be starting in January. New patient care coordinator. Hopefully I'm going to find someone soon, and they'll be starting within the next month or so, and we'll be open 5 days a week.
Wow, that is exciting news.
So we're just really growing. We've just grown and got to a point where I can't handle it on my own in 3 days. And sure. I don't want to work more than 3 days. So
there you go. Well, I think, again, that's the beauty. When we talk a lot about in the industry of business owners working so much in their business that they can't work on their business. And I think setting those parameters, and I do think that COVID changed a lot of that for our business community, in the fact that people realized, oh, maybe I can close on Sundays, or I can close on another day, when it made them go and look at their financials and their sales and say, okay, what is my slowest day? What can I do? And I think it's really important for the health of the business, but also the health of the owner and the staff, because then that rolls over to the health of the business.
Absolutely. Yeah.
Great. Well, thank you so much. Congratulations. I'm glad you heard it here first. And We are very excited that you have a growing business here in Pagosa Springs, and we appreciate the services that you bring to our community to support us.
Thank you.
And that's it for us today. Thank you again for joining us. We appreciate it. And another great story of another wonderful business here in Pagosa Springs. Please join us every Monday at noon for a new segment on our Business Spotlight series. Thanks for joining us. We'll see you next week.